Hello everyone, this is Fatima Al-Zannan, Class 701, US Healthcare System, Dr. Niraj Bandari. Today's topic is the federal government should regulate the cost of pharmaceuticals. Let's begin. Government has always intervened in the healthcare market by implementing rules and regulations. One of the crucial aspects of healthcare market is pharmaceutical industry. But as we all know that the main goal of government intervention is to protect consumer who is in desperate need for these drugs. The high cost of research and development of drugs protected by patent reflect on the unreasonable high prices of drugs in the market. In a not free market, cost control of drugs is a necessity. According to Minimum, in 2014, the pharmaceutical cost grew by 13.6%, and the profits of pharmaceutical companies were around 20% in 2012. The reason behind the ability of drug companies to set extremely high prices on their medication is that drugs do not operate in a normal market. The continuous increases in drug prices are negatively affecting the overall healthcare cost, which will eventually lead to increase the premium of healthcare insurance coverage. Some opposed advocates argue that by controlling drugs prices, that would kill the incentive to innovate in the pharmaceutical industry. However, this will create a strong reason for the government to take over the drug patent, as it's commonly known that public benefits do not always comply with private benefits. Therefore, we believe that any sort of government intervention could help to protect patient rights, either by reducing the prices or ensuring the safety of drugs. Further explanation of patents. Patents give the drug companies an excuse to increase the drug prices to the maximum. If the drug is protected by patents, this allows companies to act as a sole supplier of this medicine, which will permit the companies to charge profit-maximizing prices. This eventually will only harm the consumer, who is either the government or the patient. One of the interesting information I passed through my research, a codified law at 28 USC section 1498 gives the federal government the ability to reduce the prices of high-cost drugs. By this law, the government has the right to use patent inventions without permission and pay the patent holder a compensation. Advocates for government intervention in drug prices believe that this law should be used whenever there is extreme pricing in drugs against the overall cost of research and development. Another policy suggested by the government to reduce the federal spending on Medicare prescription is the Medicare drug price negotiation. This law will allow the federal government to negotiate the price of prescription drugs on behalf of Medicare Part D beneficiaries. This law aims to reduce federal spending and ensure the affordability of medications. Last but not least, the Food and Drug Administration. It's one of the federal agencies under the Health and Human Services Department. Its mission is to protect patient safety and promoting public health. FDA approval is crucial to companies who are developing new drugs. Without FDA's approval, the drug cannot be released for sale in the United States. The FDA has no legal authority on drug prices set by drug company. However, the agency is responsible to facilitating and increase competition in the drug market through the approval of lower-cost generic medicines. Thank you for your listening and have a pleasant day. Last but not least, the Food